A very good welcome to all of you who are joining us to talk about the schools and the schools management and support that we're offering to schools in preparation for them reopening. I think it is quite clear that at this point we are likely to take a little bit of time before the schools open, but we cannot wait till the schools open for us to tell you what we can or cannot do for you. So therefore, today we are looking at what the XiTe Group of companies, along with Dr. Caswell, Nkuna, who is myself, can be able to do for you as the schools, and using technology to ensure that the screening of children as and when they are back at school is done in a safe manner, in a manner that would ensure that there's no stigmatization, in a manner that would ensure that everybody in the value chain is safe. As we go through this, we'll be putting up some slides and we'll be sharing. However, we need to bear in mind that we're doing all of this because of the fact that our president has declared that come end of May, we're moving to stage 3, even though it will be in various areas, and other areas will not necessarily be able to move to stage 3 due to the high prevalence of COVID-19 in those areas. So as you join us in this live broadcast, we are, as We appear, we are Dr. Caswell, Nkuna Incorporated Practices, coming along with the XiTe Group of companies to be able to give you our services and ensure that our children are safe and ensure that we can be able to be of value to you. This is a live broadcast. However, the recording for this will be made available after the end of the broadcast. So join us as we go along and inform our people to ensure that we do not leave anyone out. We are coming to you live. First things first, we need to just outline from where we are standing as to what exactly are we doing here. We are a group of companies who have been practicing occupational medicine in the field of healthcare, and we have set up a few offices previously and served in various capacities for various clients. What is important to understand is that every workplace, including a school, and in particular, we are talking about a school and schools as we prepare for their reopening, have some element of risk associated with it. The young man dangling upside down, head down from the trees himself, not aware of the imminent danger of what would happen to him should he slip and fall. And we are here as occupational medical doctors and managers of services in healthcare to be able to come to the school to ensure that we know what is happening, but more importantly, to assist you in ensuring that the COVID-19 does not render our schools as areas of great concern. And as parents, a lot of parents, we are concerned that as and when our children are going to be going back to school, where exactly and what exactly is going to be happening. It has been alluded to that all schools should be able to screen the children. We'll talk about that as we talk about where exactly are the risks, what exactly are those risks. However, we need to understand that from home to transport, to the boarding house, to class, and even in the playground, there's always a risk. However, let us not despair and think it cannot be mitigated for, because it can be mitigated for. We offering you an innovative partnering as parents and teachers in school management to be able to understand what exactly it is that we can do so that we can give you the reassurance that you will not be sending your children to a death or kernel. We know that it's not nice to be talking about some of these things, but we need to be able to go beyond fear and tackle all of this head on. Our systems are able to give you feedback in real time, because none of us as parents would like to wait for me to submit something and then get feedback in a short time or in an hour or two's time when my child is already going to be going on the bus to be able to go to school. So we need to be able to understand that our children need to be safe. We need to know as and when they are in imminent danger so that we can do something about it. Our system that we use and are going to implement for those schools that have not yet joined us, we're going to be able to ensure that we give you guys access in all forms, including televisually. Now here we are talking about a televisual system where anybody can be able to see the other as and when they do consultations. But this is not the key or the primary purpose for which we want you to understand our system. The most important thing is that we are talking about screening, with the help and the participation actively of parents. And once that is done, we are now talking more about the parents knowing before the child leaves for school, because you need to know as a parent. We're talking about where exactly are we going to find ourselves? Should we be allowing public transport systems as organized transport providers to be taking our children to school? And as we do that, what risks are they going to be faced with? And how are we going to mitigate for those risks? As the child comes to school, are we aware of what the school management is actually faced with? Because the school management, as an employer, needs to ensure that they know how their employees, who are the teachers, how healthy are they, so that no one person who is unhealthy is at school. And the teacher needs to know in his own class, how is it that he can know that all his children are healthy? Now, our system is actually going to look at that whole value chain so that at least we can be able to understand that we can make a difference at each point, and our information flow and information management can actually be done in such a way that there are no gaps. But what is important also is to ensure that the information that is so entered and submitted is done so in a secure manner, and everybody can get access to their information, to their reports, without having to fear that someone else is going to get that information as well. Privacy is quite important, and in the relationship between doctor and patient, that rapport creates a very good relationship. Now, what do we envisage? We envisage that the parents will check their child at home and enter information into the app through the secure portal. By screening at home, as we have said, it allows for the privacy to be guaranteed. It reduces the possibility that as and when a child is supposed to be screened, if the child were to be screened at school, that child will already be exposed either through transportation if they're using the public transport route and or organized transport routes. They would be exposed as and when they're waiting in the queue to be screened as and when they get to school. So by ensuring that screening is done at home, what we're doing is that we're saying the parents take responsibility. But the question is, how then is the school going to be aware? And this is what we are going to be talking more about, because our app is able to ensure that that information flow is provided for. Bear in mind that if a child is picked up having been screened and has a suspicion of a disease or sickness, one thing that is going to happen, that child will be put aside, and that could promote, not that it should, it could promote stigmatization. And if that were to happen, we are going to find ourselves with bigger problems in our hands. So we need to ensure that as we screen in the privacy of our homes, ensure that we are able to transmit the information to the school via means and apps that are able to ensure that there is privacy. If during the screening process, as we have said at home, you find that you have unwell child, a system of consultation, which is the televisual system that we had spoken a little bit earlier, will be activated. And one of the other presentations, we're going to be going through that as to how exactly can this be done in order for you guys to be able to utilize this tool so that you can gain access to doctors and be able to not endanger yourself or the lives of your loved ones. So, what can we do for schools? Schools have employees as well as students. The employees are the educators, and support staff. What we do, we give them access to the app, they do the self-assessment at home, they submit on the secured portal. Immediately they get a confirmation of their wellness status via SMS. If they are having suspicion of being unwell due to the information entered, the SMS will come and indicate that they need to make an appointment with their allocated doctor. Because here what we are doing is we're talking about the app at the time of use, but not the administrative components, because there is the administrative part where you first have to register, the school has to register, the teachers have to register, and the students have to register. So having that taken care of that administrative part, it implies that now all the information is stored along with your preferred doctor's information will be stored because you would have entered it. Once you have entered all that information upon registration, the minute you are found to be unwell, an email or an SMS can be sent according to your subscription level, can be sent to the doctor to indicate you are going to come and see him if he doesn't have televisual consultations. It is advisable, though, that you do not use physical face-to-face consultations during this time as we're faced with this whole COVID-19. Because bear in mind that by the time you have somebody in front of you who has COVID-19, you yourself are exposed, and therefore there's certain protocols you need to follow. So the most important thing that needs to be borne in mind is that as and when you are suspected of having COVID-19, the best thing is to consult online. However, given the fact that you will be getting a report at that very moment, you will then be able to act on it. It is also quite important to understand that the process that happens for employees is the same as would happen for anybody else who will use the service. So, as an employee or as a teacher, you will enter after the school has been registered and yourself have been registered on the app. You will enter your daily screening findings. And we are saying this daily screening findings because we believe each one of us can be able to assess themselves at home. We all have some element of a thermometer at home, especially at the time when we had children that were young. We used to buy those small thermometers which are electronic. It is that which you can use and not just a infrared scanner. Yes, if you have the money to be able to afford it, it's best. But we are going to announce further going forward if we can be able to provide you with these tools, given the huge demand and shifts in pricing from day to day. If it is possible for us to source them out for you, we will be indicating in due time. So, having done your own assessment, you enter it into the system. The system tells you you are fine or you're not fine. If you are not fine, you go and consult according to the televisual consultation. And if you are fine, you pitch for work. However, school management now has to know of my employees, the staff, including teachers and support staff, who is and who is not healthy. They will get a dashboard. I'll show you a little bit of a dashboard later. That will actually be having the drill down functionalities to be able to drill down as to the names of the people that you're responsible for. So for the teacher, it will be, first let's take the parent. The parent will always want to know, well, the results of my child from previous times. Secondly, if you are using public transport, you want to ensure that you know that if the driver is registered, has the driver screened. Because if the driver has screened and is okay, the chances are he will not have much of a problem and therefore he will not transmit it or spread it forward. So the parents will have access to their children's information as well as the driver's screening results. But now here is the most important part. it is only that driver that you have contracted with a provider whom you're going to have access to, not all drivers. This is blocked already. You will not be able to see any other person except for your child and for the driver of your child. Secondly, as a student as students have entered their information whilst at home, they will also have certain aspects of the reports. And these reports include their reports from previous as well as any other information that applies to them. They will not be able to see any other information. We need to understand that there are other levels that are going to be using the system, including, as we said, the teachers, the school management, the company that is providing transport and his employees, and the parents. Each one only sees information pertaining to themselves and the people they are responsible for. So as we were saying, the school will be seeing information related to educators and support staff. And the teachers will be able to see information pertaining to their students and only the students that are in class for that particular teacher, not the other classrooms. What is important is to understand that, as we have indicated, the most important thing is to ensure that there is no infringement on privacy, there is no risk that is carried. Because I need to stress this, by the time a COVID-19 infected or person of interest is standing in front of you, you yourself have just become a person of interest because the transmission could be happening at that time. So what we are looking to do is to ensure that these screenings are not happening at the school grounds. They happen way before people arrive at school, whether you are a teacher, whether you're a student. Before you arrive at school, you need to make sure that your information has been transmitted so that no one would be left in doubt as to what exactly is happening. The reporting systems are online, via SMS, and many other functionalities exist within the app, the drill down of the virtual online platform where consultations can be conducted by the doctors that have such, and those who don't have, using simple telephone calls will also do. How do you get your reports? Or which reports, and how accessible is the app to you? You need an internet system, or at least an internet connectivity, to be able to access the system. Before leaving for school, parents have access to the app's forms as well as the reports, but it's only for the reports that pertain to their or to their loved ones. Transport providers will have access to their own reports, but as well as that child whom they are carrying need to protect the others. So a driver of a transport provider will have to have a mobile app that he can look and see that all the children in the bus have been screened before leaving home. Because if that is not done, it becomes problematic. It means the exposure can be there that would endanger other children. So the driver is going to be important. Bear in mind that the only information is the information pertaining to screening and no more than that. That needs to be clarified, and people need to be comfortable in knowing that there will be no other information that will be passed on. The school management will have access to the teachers and the support staff dashboard reports with drill down functionality. And a class teacher will have his or her own students' dashboard and drill down functionalities, which means he can or she can be able to see the name list of the students that have done the assessment. It is important to understand that there are costs involved, and this is on a subscription basis. And for that, we are willing to ensure that everybody is able to have access. For schools, it depends on how many teachers you have. If you've got more than 20 teachers, at least it's 5,000 rands a month, up to 100 employees, and each further 100 or part thereof, they will be paying another 5,000. Depending on the number of employees you have, you will pay slightly more and more, but in batches of 100. For parents, we have 3 options, which are all subscription options, ranging from 250 rands a month up to 450 rands a month per child. It is important to understand that the 250 rand option covers for exactly the same things. It just depends on what other bells and whistles are added as and when we do what we do. So it is affordable, it is accessible, and it is in the control of your hand. And that information is not going to be passed via paper, which is going to carry a risk. What we need to understand is that passing forward pieces of paper will in themselves transmit the virus as well. So as and when you guys are looking out to this system, bear in mind the advantages that it actually ensures that you guys have the protection, the safety, the privacy, as well as no stigma. I need to stress that the stigma part could possibly be an issue, because a child who is picked up at school, if the assessment is done at school, will have to be put aside so that they can be able to ensure that he doesn't mingle with others, despite the fact that he is already mingled. So that in itself might promote stigma. The system takes away that. Let's bear that in mind. Now let's go and look at what you guys will be signing up for. As and when you sign up, you will get access to the secure portal, which portal you will use your email address that you would have used to register. You will be getting confirmatory communications from time to time as and when a particular action is undertaken. So please bear that in mind. Once you have gained access to the app, there will be specific forms that you will be able to fill from inside the form, and then you will get that information easily. You will call up your own information, and all the time at every level of entering information, you will get confirmations that are applicable to that particular form. The school will ensure that everyone gets the form, because we need a system where you get the link to the form in order to register, but the workflow should be simple. It's the school first, the school management second, who registers along with their staff, and then the children. And the purpose for that is this: a child will need to select who the teacher or his or her class teacher is. Those schools that don't use class teachers and use houses, that's exactly what we're referring to here. So you cannot have a child register without knowing who his or her teacher is, or if the teacher is not on the system. The teacher has to be on the system, but the teacher, as they register, will also have to be selecting the school they are registered with. So they will need to make sure that the school is registered first, then the teacher, and then the child. And once that has been done, the reports will flow accordingly. Should it happen that the information is not entered in that sequence, where the employer or the school first, the employee or the teachers second, on the management and support staff, and thirdly, the child or the student, the reporting might not reflect the students that are for a particular class within a school. It is quite important that we remember that. Should it happen that somebody then becomes suspected of being sick, a confirmatory SMS is sent to that particular person, indicating to them to consult by going online and ensuring that they schedule their booking. They will then get further instruction from there onwards. We're going to put another session where we can share with you what exactly that process entails. But for purposes of this, we are just showing you the capabilities within the system, within the school support system structure. These are the dashboards that we've referred to a little earlier. Each of the various people that would need access to the dashboard, like the school management, the transport owner or transport companies um, management, they will get access to this dashboard. And this dashboard will be talking only about the people within their immediate area of control. We also have a function where you can be able to set as a reminder for you to do specific tasks within the app. It will send an SMS to tell you or to remind you to do specific things. Thank you very much. For now, that is about it for the schools and the schools management support and in preparation for the reopening of schools. We, however, just can indicate that we do have other services, and those services are basically listed on that slide. You are free to contact us. You're free to go onto our website, various websites, one of them being Dr. Caswell, inc.com, and the other one being XiTe for further information. However, we have produced and are going to be producing according to the various training sessions that we undertake on a daily basis, so that everyone who is supposed to be joining us can be able to join us. We thank you, those of you who have taken time to come out and join us. Thank you very much. We will be anticipating that you guys can be able to send out your questions, and we can then be able to ensure that you get the appropriate answers accordingly. Our email address is admin@xiteinfotech.com. It is admin@xiteinfotech.com. Looking forward to hearing from you. If you have questions, please send them through. We'll endeavor to answer them within a very short space of time so that you can be aware of what challenges you might be facing. Thank you very much. May God bless you. As and when we prepare for the opening of schools, we would like to make sure that you guys are reassured of the safety of your kids as and when they go back to school. Thank you. See you once more, not so distant future.